all know that sodium is an important mineral that performs many essential functions in our body. It's found naturally in foods like eggs and vegetables, and it is also considered a main component of table salt, that is sodium chloride. Though it's considered vital to our health, dietary sodium is sometimes limited under certain circumstances. For example, a low sodium diet is commonly or routinely prescribed to people with certain medical conditions, including heart failure, high blood pressure, and even kidney disease. But does this fact still hold good? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan and I'm going to talk about the impacts of how low sodium diet did not cut the clinical events in heart failure trial. As it is stated, sodium is an essential mineral involved in many bodily functions, including cellular functions, fluid regulations, maintaining a proper electrolyte balance, and even maintaining a constant blood pressure. Because this mineral is vital to our life, your kidneys tightly regulate its levels based on the concentration of bodily fluids. As previously mentioned, sodium is found in most foods that we eat, though whole foods like vegetables, fruits, and poultry contain much lower amounts. Plant-based foods like fresh produce generally have less quantity of sodium than the animal-based foods such as meat and dairy products, and sodium is considered to be most concentrated in processed and packaged foods like chips, frozen dinners, and fast food where salt is added during the processing phase to enhance the flavor. Another major contributor to sodium intake is adding salt to the food when preparing meals in your kitchen and as a seasoning before eating. Now, healthcare professionals typically recommend these diets to treat conditions such as high blood pressure or even heart diseases. Although there are a lot of variations, sodium intake is generally kept to 2 to 3 grams per day. Now, a low sodium diet was not associated with a reduction in future clinical events. This is as per a new study that was conducted in ambulatory patients with heart failure. But there was a moderate benefit on the quality of life. The results that I am talking about are of the sodium HF trial that were presented at the American College of Cardiology 2022 scientific session, wherein the authors or the researchers said that they were also simultaneously published online in the Lancet journal. The study that I'm talking about found a strategy to reduce dietary sodium intake to less than 1500 milligrams daily was not more effective than usual care in reducing the primary endpoint of risk for hospitalization or emergency department visits due to cardiovascular causes or even the all-cause death at 12 months period. The sodium HF trial that I'm talking about was a pragmatic, multinational, open-label, randomized trial that was conducted across in 6 countries, which included close to 809 patients having a median age of 67 years with chronic heart failure who were receiving optimally tolerated guideline-directed medical therapy. All the patients were randomly assigned to usual care according to local guidelines, or a low sodium diet intake was prescribed to them. Hence, when following a low sodium diet, foods that are high in sodium must be limited or completely avoided to keep your sodium intake under the recommended level. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.